This is the Second Chance at Health podcast. I'm your host, Dr. Brad Hassig. Come join me as we remove confusion from the hottest health topics by discussing the latest research, along with what we've seen with thousands of our patients and amongst our community, family, friends, and people all over the nation and world. Let's dig in. Hey, this is Dr. Brad Hassig with the Second Chance at Health podcast. Today we're coming to you with episode number 10, Look and Feel Your Best for Summer. I love, there's a great quote that talks about the best time to plant a tree was 30 years ago. The second best time is today. Well, if you're trying to get your body beach or pool or lake ready for summer, it's the best time to do that was probably 6 months ago. But now at this point, the second best time is today. So I want to give you some different ideas on things that you can do to have yourself physically, mentally, emotionally ready to enjoy and thrive this summer. We're always trying to look for ways just to improve, make little changes, get some leverage and in terms of, our lives, physical, mental, emotional, spiritual. I love John 15 verse 2 says, He cuts off every branch in me that bears no fruit, while every branch that does bear fruit, He prunes so that it will be even more fruitful. I love that pruning you look at in terms of, God's always working in us, especially if we're inviting Him to work in us, but it's not always going to be easy. It's just like with working out and having a healthy diet, not being on a diet, the stuff that you start in January and it lasts a week or two. It's having a diet, a just consistent healthy diet. Do your best 90% of the time. If you do your best 90%, of following a diet, being on a healthy lifestyle of working out, do it 90% of the time, you're going to get 90% of the results. So, that's something, just follow through on that. So there's a couple different things that I'm going to give you some different suggestions for summertime to look and feel your best. One of the biggest things, once again, when we're getting in terms of diet, some of the things that I've discussed before, but this is a great time to really tighten this up. If you're a week out, 2 weeks out, 3 weeks out, you've got a vacation coming up in July, whenever. One of the biggest things you can start with is, decrease carbohydrates. That's one thing people tend to definitely overindulge in those. It's going to, especially if we look at things, so many people now are having some insulin sensitivity, and insulin resistance. So if you can work on getting your carbohydrates lower, what's going to happen is, if you're insulin resistant, the energy from the carbohydrates, the sugar that's in that, when it converts to sugar in your system, it's not going to get into insulin, is supposed to bring that energy into the cells, and it's not allowing it to do that. So decrease carbohydrates, decrease things like wheat and gluten, sugar and dairy. Those are going to be your biggest culprits. I'm not saying don't ever have them, but the more change you want to make, the less you have of those things. That's true. Research has proven that over and over and over again. So increase your protein intake. Make sure you need to look at what your lean muscle mass is. Most people are not getting enough protein with each meal. Make sure whether it's beef, chicken, fish, protein powders at different times, you can do those things, but most people need to increase their protein intake with every meal. That's the main course. And then you're going to supplement that with your vegetables, a little bit of fruit. And like I said, if you're going to have some of the wheat, sugar, dairy, that types of stuff, just have that be substantially less than what you were doing. Next thing is drink more water. A lot of people, once again, are just way under consuming water the way they should. Shoot for a gallon. That's something just generally I'm going to give people to say that aren't used to doing it. It's probably going to be more than what you think. What you're looking for, if you're looking for just a kind of quick, short of scales that measure hydration level, body fat level. I was telling somebody earlier today, I was talking with the patient, and he was saying how, he's been working out, he's increasing protein, he's doing all the right things. This guy's, he's on it. He's doing a great job. Super proud of him. But his body weight stayed the same since he started working out, but he was talking about how he was getting stronger. And so I was waiting for it. I wanted him to say it, not jump in. And I said, well, how's the body fat doing? And the body fat's come down substantially. It's more muscle. And so luckily he had gone in and he's got a scale that measures it. And then he'd done some body composition to be able to go in and get some metrics on actually what's going on. And that's been the big thing is he's a big guy, increase his protein intake. And it was like substantially more than even what he thought he needed. So that's really helped with that. So the goal when you're drinking water, and how much water to take. The quick, easy thing, if you don't have metrics, something that you're measuring on a scale or body composition, you shoot for a light yellow urine is the goal of what it is. You don't want it clear. I've been guilty of this in the past of drinking too much. If it's completely clear, now you're starting to flood a lot of electrolytes, things out of your system. So that's not necessarily what you want either. You want a very light yellow is the goal of what that is. When we look at, so that gives you some general stuff on diet. When we're looking at what you're going to be doing in the gym, increase some of the intensity, with this, whether it's in the gym or you're at home doing your workouts. Both work great. Less rest between your sets. Supersets, things just where you're keeping your body circuits, things like that. This is a great time if you're trying to, especially like I said, if this is crash course, you've got a couple weeks before you're going to be going somewhere. This is the time to be doing that. Do some cardio after you're lifting. We want to make sure the lifting is the main course. The cardio, you burn up a lot of the glycogen, a lot of the sugar that's in your system. Get the carbs out first with the lifting. It also, when you have the energy to be able to do that, you want to put your energy towards your lifting and building and or maintaining your muscle mass. Then do your cardio afterwards. When you're tired and fatigued, that's something you can stay in a fat burning zone. You don't have to go crazy hard. Don't beat yourself up. Don't get injured. But that's the time to do that kind of that lower intensity fat burning cardio is after you've done your exercises. Do some things on vacation. Plan on doing things. That's a great time to do some body weight stuff. Do your push-ups, pull-ups, squats, find something you can, that you can do some sorts of rows or things like that. Use a suitcase, what have you. Make it kind of fun. Obviously go on, if you're at the beach, go for walks. That's a great time. Just don't overdo because you're on a slope, and we see a lot of injuries in the chiropractic, office with things that unlevel. So just, if you're not used to walking, don't go do a 4-mile walk on an uneven surface with that. But do some body weight stuff. You can take some resistance bands. I know a lot of people do that. They're small. They don't take up a lot of space. Doesn't have to be crazy hard workouts too. Have fun. You're there to enjoy. You're there to have fun. But if you start your day with that, you'll feel a lot better. So you can also do some breath work to unwind. I think that's something I know. That's a challenge for me on vacations. It takes a while to kind of unplug and to stop resonating just vibrating at that higher level that we all have in our daily lives. To do some breath work, some of the stuff that we've talked about in other episodes, go back and watch that, see some of the different options, things you can do. Enjoy, like I said, whether you're outside, at the pool, at the lake, at the beach, do that. And then always to remember, water safety, wherever you're at. I see the stats, worldwide, 224,000 deaths per year due to drowning. And just make sure and drill this into your kids. It's not something that I learned. It's not something that people really realized was an issue. No breath holding games in the pool. None of this. Let's see how many times we can go back and forth across the pool. Let's see how long we can hold our breath underwater. Don't encourage it, discourage it. Make this is something we just don't do. It's so dangerous. So that's very, very near and dear to my heart. That's a mission I'll be on for the rest of my life. Getting ready to go to a board meeting for the hypoxic underwater blackout group this week, and we're going to be talking about stuff. So that's on my heart. Make sure lead kids right. Don't teach them those games, and if they're doing it, discourage it. Get them out of that habit as soon as you can, so that we can have some fun. We can enjoy it. Hope everybody has a great summer. We'll continue to have the podcast. Listen to it. Tell your friends about it on the beach. Run up and down the beach. Tell them about this great podcast. Share it with folks. And I hope it allows you and your family to have a great summer. Take care.